Heart failure and cardiogenic shock are both serious heart conditions, but they differ in severity and presentation. Heart failure occurs when the heart can't pump enough blood to meet the body's needs, leading to symptoms such as shortness of breath, fatigue, and swelling in the legs and feet. In contrast, cardiogenic shock is a more severe critical condition resulting from the heart's inability to supply enough blood to the organs, causing symptoms like low blood pressure, rapid heartbeat, and confusion. Treatment for heart failure may involve lifestyle changes, medications, or surgery, while cardiogenic shock requires immediate emergency care to improve heart function and prevent organ damage. Risk factors for both conditions include coronary artery disease, high blood pressure, and previous heart attacks. Here's detailed aspects of each disease to understand their implications on health. Affected system, compensatory stage versus decompensatory stage. Heart failure is a chronic condition where the heart struggles to pump blood sufficiently, leading to symptoms like fatigue, breathlessness, and edema. Initially, in the compensatory stage, the body can adjust to maintain cardiac output through mechanisms like heart rate increase and muscle mass enlargement. However, when heart failure progresses to an acute decompensatory stage, it can lead to cardiogenic shock, a severe, life-threatening condition where the heart cannot supply enough blood to the organs. Unlike the chronic nature of heart failure, cardiogenic shock is a medical emergency requiring immediate intervention as the body's compensatory mechanisms are overwhelmed, leading to hypotension, organ failure, and potential mortality without prompt treatment. Onset of symptoms, gradual versus rapid. Heart failure typically presents with a gradual onset of symptoms as the heart's ability to pump effectively worsens over time. Patients may notice increasing shortness of breath, fatigue, and edema as the condition progresses. Conversely, cardiogenic shock occurs rapidly and is a medical emergency. It is characterized by a sudden and severe decrease in cardiac output following a heart attack or end-stage heart failure, leading to inadequate tissue perfusion and organ failure. Symptoms of cardiogenic shock include sudden extreme breathlessness, profuse sweating, pallor, a rapid but weak pulse, and a loss of consciousness, demanding immediate intervention. Recognizing the tempo of symptom onset is crucial for timely and appropriate management. Hemodynamic status, reduced ejection fraction versus critical reduction. Heart failure with reduced ejection fraction, HFrEF, signifies a chronic decline in the heart's pumping efficiency, where the ejection fraction, a measure of the blood volume pumped with each heartbeat, is significantly lowered. Patients may experience breathlessness, fatigue, and fluid retention. However, they may remain hemodynamically stable with proper management. On the other end of the spectrum lies cardiogenic shock, a critical condition where the heart suddenly can't pump enough blood to meet the body's needs, often following a severe heart attack. Here, the ejection fraction isn't just reduced, but critically so, leading to hypotension, organ failure, and requiring emergent, aggressive interventions. The differentiation hinges on the hemodynamic stability. While HFrEF is a chronic state that can be managed on an outpatient basis with medication and lifestyle changes, cardiogenic shock is a medical emergency necessitating rapid stabilization, often with mechanical support and intensive care. Blood pressure trend, mild to moderate decrease versus severe hypotension. Heart failure and cardiogenic shock, both resulting from the heart's inability to pump sufficient blood, present diverging blood pressure trends. In heart failure, there's typically a mild to moderate decrease in blood pressure, attributed to the heart muscles' reduced contractile function. Treatment often involves medications to improve heart function and decrease fluid overload. In stark contrast, cardiogenic shock is characterized by severe hypotension, a medical emergency signaling critical decreases in cardiac output. Here, aggressive interventions are needed, such as intravenous medications to support blood pressure and cardiac catheterization for mechanical support devices, or to relieve a blockage, reflecting the urgency of preserving organ perfusion and preventing further deterioration. Response to treatment, manageable with medications, versus requires immediate intervention. Heart failure and cardiogenic shock may present with similar clinical features but differ significantly in their responsiveness to treatment. In heart failure, a patient's condition can often be stabilized and managed with a regimen of medications such as ACE inhibitors, diuretics, and beta blockers, offering symptom relief and improving life expectancy. Conversely, cardiogenic shock is a medical emergency that necessitates immediate intervention, generally beyond medications alone. Treatment typically includes aggressive measures such as mechanical support with devices like intra-aortic balloon pumps or ventricular assist devices, and potentially urgent revascularization if ischemia is the underlying cause. The distinction between the two conditions is crucial as it influences the urgency and type of treatment required, profoundly affecting patient outcomes.